have Dr. Ann McTiernan here to speak to us. And happy it's Breast Cancer Awareness Month, everyone. Um, Dr. McTiernan is a distinguished faculty member here at PHS, an MD, PhD, and internist and researcher, and has been active with us over the years, helping us think about how to keep our patients more active, and really have been a huge inspiration for our current integrative medicine program and, it's a stepping stones on the way to us having a full cancer rehab program. She is also on the faculty of University of Washington and has agreed to talk about a controversial topic today, which is alcohol and breast cancer.
Well, thank you, and thanks to Dr. Linda and colleagues for inviting me. When they asked me, I said, sure, I'd love to do that. It would be fun. And I've worked in various aspects of alcohol and breast cancer as part of the work I do in nutrition and lifestyle factors and risk of breast cancer. But for this talk, I was able to look through research in various aspects that touch on alcohol and breast cancer, and I learned as I was doing this, so I really appreciate that. What I'm going to be talking about primarily is the epidemiologic evidence of linking alcohol and breast cancer, but also some on mechanisms and on alcohol in people who already have a diagnosis of breast cancer. So, as a disclaimer, I wanted to say I do not drink alcohol, but I used to. And I'm happy at some point if anybody wants to know why I chose not to drink alcohol. It's not related to cancer, but the choices I made based on knowledge I had on alcohol and risk of various diseases and cancer. But I put it in here too because one time I was asked, this was last year when there was news reports about alcohol and breast cancer, and one of the comments when the article came out was, well, what about this researcher? Does she drink? And so I thought, sure, I'll put that in as a disclaimer. In terms of disclosures for this talk, I just wanted to let everybody know I do get some funding from the Breast Cancer Research Foundation and from NCI and NIDDK, the Diabetes Institute. The first item up there, World Cancer Research Fund, I was on an expert committee for a dozen years that looked at alcohol and breast cancer. And I'll be presenting data from that work. So I thought the questions I thought would be interesting to go over for this talk are, how does alcohol affect risk? And does risk depend on the amount of alcohol? And what about the type of alcohol? Another question is alcohol safe for breast cancer survivors? And what mechanisms might explain associations between alcohol and breast cancer risk? Well, the first thing that comes to my mind when you do epidemiologic studies, you really want to know what's the exposure you're interested in and what's critical, what's the outcome. In this case, it's breast cancer. In epidemiologic studies, a well-conducted study will be pretty good at defining whether somebody has breast cancer. The older studies didn't look very much or didn't have the information to look at subtypes of breast cancer, but they were able to say whether somebody had breast cancer or not. So the epidemiologic studies could be cohort studies where you identify people who are healthy at one point in time, ask them questions about their lifestyle, medical exposure, the medical history, and then follow them over time and see who gets the disease. And in this case, it's breast cancer. Those are called cohort studies. There's another type of study called a case control study, and that's where the researchers identify people with the disease, in this case, breast cancer, and then compare them to comparable people without breast cancer. For a cohort, the cohort often, if people are enrolled when they're healthy and they have an average risk of disease, average risk of breast cancer, you may need to follow them for many, many years before you have enough cancers developing to be able to say anything about cancer in relation to the risk factors you're looking at. So, so breast cancer is um, uh, usually defined and found in very careful ways in these studies, and it's usually with pretty high validity. In terms of the measurement of the exposure, in this case, alcohol, it's a very different question. So there are different ways to find out how much alcohol somebody is using. In clinic, it could be self-report. The clinician asks the person how much they drink. Um, Knowing that if you ask somebody, do you drink? You might have them say, no, I don't drink at all. And it may be that they don't feel comfortable telling you, or they don't consider how much they drink to be relevant, or there's somebody with a real alcohol dependency program and dependency, and they don't want to talk about it. In epidemiologic studies, usually we're asking people questions, specific questions about their use of something, in this case, alcohol. And most of these epidemiologic studies were not designed specifically to look at alcohol. It's one of many, sometimes hundreds of items, hundreds of questions that were asked of people to then later on look at the associations with cancer risk. So there's one tool we often use. It's called a food frequency questionnaire. And Fred Hutchinson has a really outstanding nutrition science department. So in a minute, I'm going to show you a questionnaire that they developed and that I've used in my studies, and that the Women's Health Initiative, which was a very large cohort and clinical trial, that used. And I'll show you the example of how these questions are asked in these settings. Another potential way to ask about alcohol intake is through a food diary. That's where you're asking a participant to write down everything she's eaten or drunk over a certain number of days, often 7 days. So it gets to be tedious, but people are willing to do it as part of a study. Another way is a 24-hour diet recall. And these used to be where somebody agrees to get a phone call at some point. Usually they're not announced. They get a call and then they're asked questions about what they've eaten or drunk in the last 24 hours. Nowadays, a lot of this is done electronically, but whether it's done through paper and pen or electronic or telephone, they're all different ways of trying to collect the same information. But the thing to know about these methods is that they're typically asking about all kinds of pieces of information, usually not designed only for alcohol intake. So the individual is really trying to remember hundreds of things that they either eat or drink over certain periods of time. For food frequency questionnaires and cohort studies, if somebody enters the cohort, they're usually asked to fill out that questionnaire, and they'll ask to do it. What do you typically eat or drink? And the questionnaire might say in the last 3 months. In case control studies, usually the goal is to find out what somebody was eating before they developed cancer. So you might be asking them to remember what they ate a year ago. So there's a lot of recall involved, and usually people are reporting what they like to eat, what their patterns of eating are when you look at the questionnaire results altogether. What about biomarkers? In clinical studies, often you want to know if you want a more accurate measure of whether somebody's got some exposure, in this case, alcohol. Well, we clinicians know that you can test blood alcohol levels, but that's only going to be useful for acute levels and especially for high levels. So in the emergency department, somebody may get an alcohol level taken. And there are a number of blood markers that have been developed, but they're not in wide use for epidemiologic studies. And I didn't see any evidence that they were used for any of the papers that I looked at. So most of the epidemiologic studies on alcohol and breast cancer have used food frequency questionnaires, like I mentioned. The cohort studies took in dietary intake, including alcohol, at the time the person entered the study. So, and then some of them repeated those questionnaires so that you could get more of a long-term look at what somebody was eating. But if somebody entered the study, let's say the Women's Health Initiative cohort, women were 50 to 79 years old when they entered that study. We didn't have any information about what they were eating or drinking 20 years before that, or as a teenager or a young woman. So you really it's like a snapshot at one period of time in these studies. In case control studies, as I mentioned, it's often dietary recall, often for a year before they entered your case control study. These food frequency questionnaires typically have many questions on them. The Fred Hutchinson food frequency has 125 food and drink items, and I'll show you what the format looks like. But in general, these studies have wanted to know how often a person drinks beer, wine, spirits, hard liquor on an average week or month, and what the serving size is. So we're going to get into that in a second. So this is my very poor attempt at copying what the alcohol sections of the food frequency are. And let's see if I can use a marker. So you see, this is at the end of the study, the end of the food frequency. People have already filled out about 120 food items, so their heads are already spinning a little bit. Now they're asking about beverages. And so there's a column where so people are asking to bubble in their results. And there's a column for never use. But then there's various different levels of number of times per month, week, or a day that they're completing them. And so they asked to complete this from multiple types of beverages. Oops, sorry. And they're given an estimate of a typical serving. For something like milk, it's 1 cup. That would be a typical medium serving. There's no specifics on the smaller or larger. But look down in here on the alcohol screen. And you can see there are 4 types listed: beer, red wine, white wine, and rosé, liquor or mixed drinks. And you can see that the size, what's considered a medium size, is about 6 inches. 6 ounces. For wine, it would be 6 ounces, and for beer, it would be 12 ounces. A lot of people drinking beer will be drinking it in a can or drink out of a glass poured from a can. So they're pretty good at estimating how much alcohol they're drinking. Maybe they drink 1 or 2 cans a night or something. But for something like wine, it's often very difficult for an individual to know how much wine they've poured themselves, how much they got in a restaurant, and similar things for hard liquor. The US has some standard drink sizes that they use for their reporting and advice and for research. And so the US standard drink contains 14 grams of alcohol or ethanol. In Europe, the standard drink is 10 grams, so that's about 4.5 ounces, and 4 ounces of wine, for example. And in a lot of these epidemiologic studies I'm going to talk about, they use a level of increment of about 10 grams. And so when I talk about that, just think it's like a small glass of wine or a little bit less than a 1 shot of alcohol, of stronger alcohol. Well, I thought I'd do a little experiment myself because I just know how difficult it can be for people to have an accurate guess of how much alcohol they're taking in. And the reason it's so important to know is that these epidemiologic studies use amount as a way to determine associations, but then later on, policies and advice given to the population or to patients depend on amounts that you see in these scientific studies. And the point I'm trying to get across is how difficult it is to be exact. So I went through a process of filling some glasses with this is not wine, it's just colored water. Um, but the question I have is which glass contains 4 ounces of liquid? Well, the answer is they're all 4 ounces. So and it was so difficult for me. I even remeasured a couple of them because visually they don't look like they're identical amounts. And so imagine a person trying to figure out, they go out with friends a few times a week, how much wine are they really drinking? That's going to be very hard to be exact. So I'll talk about some summaries that were and evaluations that were done for this question. One is by the International Agency for Research on Cancer. It's a branch of Women's Health of the World Health Organization. They looked at alcohol in 2010 and 2012. I'll also present data from the World Cancer Research Fund and newer data from the national academies. These groups have done the summaries for me. There've been over 100 or more studies on alcohol and breast cancer, and with the short period of time here, we can't go through all of them. But these people did excellent summaries, and we can take away information from them. So first I'll talk about IARC. So this IARC, International Agency for Research on Cancer, convenes expert panels, and they summarize evidence on carcinogenicity. So their goal is to look at a substance or an exposure and say, is that a carcinogen? They don't get into determining how much an individual's over their lifetime or any period is going to be exposed to this. They talk about, is that substance carcinogenic to humans, to animals, and what's the level of evidence? So in 2010, they looked at the studies. They had done systematic reviews. Systematic review in epidemiology is when a researcher investigates, just searches for every study that fits certain criteria, looking at an exposure and a disease. And so IARC does systematic reviews, and they just happen to cite a pooled and non-cases of breast cancer were compared and evaluated and found that for each 50-gram alcohol increase per day, the relative risk of breast cancer increased by 50% versus non-drinkers. But they determined, that was just an example they gave. They determined, looking at all the data together, that alcoholic beverages and ethanol, which is the active ingredient in alcohol beverages, are carcinogenic to humans. In 2012, they looked at it again. They reaffirmed this, including breast cancer in women. And they also confirmed that acetaldehyde, which is the main metabolite of alcohol, is carcinogenic. The World Cancer Research Fund is a research organization and a network of charities. And what it does is it focuses on not just any carcinogen, it looks at nutrition, diet, physical activity, body composition, and risk of various cancers, including breast cancer. And it convenes expert committees to evaluate the data. So I served on an expert committee for about a dozen years, and we looked at multiple cancers, multiple types of these exposures, including alcohol. And so if any of you are interested in looking more into any of these factors and risk for cancer, then the World Cancer Research Fund has a very helpful website with a lot of tools on it, useful for clinicians and researchers. So in 2018, they put out a report. And what I wanted to do was show you the results of their meta-analysis on alcohol and breast cancer risk. Now, meta-analysis is the result of a systematic review in the statistical combination of studies. So in this case, the researchers at Imperial College that were working for the World Cancer Research Fund collected the papers from a systematic review of alcohol and risk of breast cancer, and then combined the data together. And this is what's called a forest plot. A forest plot shows the relative risk of a disease, in this case it's breast cancer, associated with using with exposure to some agent. In this case, it's alcohol, and the relative risk is calculated per 10 grams per day. So it's about 4 ounces of wine, half a beer, or sorry, a little more than half a beer, and calculates the risk overall. So the overall risk they found for postmenopausal breast cancer was a relative risk of 1.09. It was statistically significant. So that means that for each 10-gram increase in alcohol per day, the risk was 1.09 or 9% increase. And then these are multiplicative. So if somebody's drinking 20 grams a day, it would be a 19% increase. And if somebody's drinking 3 of those small glasses per day of wine, for example, that's a 30% increase. Well, 30% increase, what's that comparable to? Well, an example is hormone replacement therapy. The Women's Health Initiative showed a 30% increased risk of breast cancer with use of estrogen plus progesterone over a certain number of years. And this meta-analysis showed any type of alcohol increases risk. Doesn't matter how you take it. They also did a meta-analysis for premenopausal breast cancer. So same methodology, and they found a 5% increased risk of breast cancer. And one thing I should mention, most of the cohort studies that they used to determine these relative risks, they were primarily in Western white populations. So we don't know as much from some other populations. So 5% risk, a little bit lower in premenopausal than postmenopausal. So 5% risk for each 10 grams increase. That's about a 16% increase for if somebody's drinking 3 drinks a day. More recently, the National Academies of Science, Engineering, Medicine was asked to review evidence on alcohol and health. They were asked by the US government to do this. This is commonly how they do their work, based on what the government has asked them to do. And they focused on moderate alcohol use. And remember, this is a US group, and so they determined moderate use being 14 grams of alcohol for women per day. They included multiple outcomes, including heart disease, but they also looked at incidence of breast cancer in women. And one thing they wanted to know in particular was what's the effect of moderate drinking, and they wanted to make sure that studies did not combine former drinkers with never drinkers. And the reason is former drinkers can be people that stopped for a particular reason that could interfere with the interpretation of data. So former drinkers, for example, may have stopped because they were excess drinkers, or they may have stopped because of some health reason. So these to be considered for their analyses, the never drinkers had to be people that just chose on their own not to drink. And they found a meta-analysis for breast cancer. They did a meta-analysis, and they found a 10% higher risk of breast cancer for moderate versus never using alcohol. So that's 1 point, relative risk of 1.1. And then they also determined there was a 5% higher risk of breast cancer for every 10 to 14 grams increase. So they did see a dose response similar to what was seen in the World Cancer Research Fund analysis. So there are some limitations to epidemiologic studies. Most of the studies assessed alcohol at the study entry without updating. Most study participants were in their 40s to 60s when they were asked about their alcohol use. But there were very few data on teenage use and young adult use. It's really uncertainty about alcohol amounts used. And there are very few studies on alcohol patterns. For example, does binging affect risk of breast cancer? We don't know. Very few studies looked at in change in alcohol intake, and I'll talk about that in a minute. And there are no studies of biomarkers of alcohol intake. So we're really dependent on what the woman tells us based on what she can remember and how she can guess on how much quantity she's drinking. Um, what about prognosis? What about women who've had breast cancer? What happens to their risk of future cancers or of survival if they're drinking or not drinking? And so the meta-analysis was done also by World Cancer Research Fund, looking at per 10-gram alcohol day increase. And what they found, looking at all-cause mortality, they didn't find evidence of an association. They looked at breast cancer recurrence. They did see some suggestion of 9% lower risk. It was marginally statistically significant. When they looked at high versus low alcohol intake, and that's very non-specific, but that's because different studies classify high in a different way than others do. But looking at only 3 studies, that's all they had at that time. That was 2018. They didn't see any association with recurrence. They saw one study found that 7 or more drinks versus no drinks per week almost doubled recurrence risk. Looking at all-cause mortality, there was evidence of a 10% reduction in all-cause mortality. So that includes every potential cause of death, and reduction in post-diagnosis alcohol use, and quite a bit higher reduction in cardiovascular disease mortality. Now, cardiovascular disease mortality is important in breast cancer because women with breast cancer have increased risk of cardiovascular disease compared to the general population. So what could be causing it? What potential mechanisms are there? Well, ethanol, which is the active ingredient of alcoholic beverages, is metabolized primarily to acetaldehyde. And both ethanol and acetaldehyde in experimental studies has been shown to have several different effects that can explain carcinogenesis. And I'll just point out a few. But this is a nice photo that came from one of the a paper on mechanisms. Certainly, we know that breast cancer can be hormonally dependent disease, meaning hormones at certain levels can be associated with increased breast cancer risk. There was one recent meta-analysis that showed some increase in estrogens and other sex hormones in individuals who drank alcohol compared to non-drinkers. We also know that cancer can be caused by excess inflammation, and that's been associated with alcohol use. And these are in experimental studies as well. Acetaldehyde can cause DNA adducts, which can cause DNA mutations, and various other types of DNA damage. That reactive oxygen species can be caused by alcohol that then can affect metastases and angiogenesis. Oh, sorry. There's some additional mechanisms that are mentioned down here. Some of these are a little more relevant to other cancer types, but certainly you'll recognize several that could be related. And we do know there are people with genetic polymorphisms that affect their ability to metabolize ethanol, having much higher levels of acetaldehyde. And that's a particularly uh, high risk group for effects of alcohol. So another question that's really important for the patient populations is can women reduce risk by stopping or by reducing their alcohol intake? And in order to answer that question, studies really need to ask about alcohol intake at various time points. The errors in measurement that I talked about earlier can be compounded when looking at differences in intake over time. In terms of breast cancer risk, the International Agency for Research on Cancer, IARC, did a systematic review and found limited evidence for breast cancer risk with cessation or reduction in alcohol use. But there was evidence of a 5% reduction in risk with cessation. And that's published by investigators that worked on an IARC review. And there's some evidence that association with cessation might be limited to estrogen receptor positive disease. In terms of breast cancer prognosis, there have been very few studies that have looked at this. So if somebody is drinking alcohol, if they stop or they reduce the amount of alcohol, is that going to affect their lifetime risk of from cancer outcomes or other diseases like cardiovascular? Well, there's very little known. There was one study that was done through Dr. Chris Lee's group that analyzed differences between what women said they were drinking before diagnosis and then after diagnosis of breast cancer. There were over 7,000 women in that group, and it was from the Women's Health Initiative. Unfortunately, they only had the post-diagnosis intake from about a quarter of the women. So it had less power to determine real effect. But even so, that they summarized the results that the change in consumption patterns after diagnosis did not appear to be associated with either all-cause or breast cancer specific mortality. Coming back to IARC, I mentioned, does systematic reviews to determine carcinogenesis. And they publish those in what they call their monograph volumes. But IARC also does reviews focused on prevention. And one they did just recently on cessation of alcohol consumption or reduction. And so they were trying to answer that important question. Does it help to reduce or stop drinking alcohol? And they were looking at all types of cancer. But I just want to point out this middle area here. They determined that there was limited evidence that either cessation or reduction in reduction in alcohol intake affected breast cancer risk. But they did point to some interesting evidence from human studies. So these are studies that asked people who were in alcohol programs or entering alcohol addiction programs, asked them to join a study, and those individuals who agreed had blood drawn, so that both at the time they were drinking or shortly after they were drinking, and then after several months of not drinking. And they did find several different effects. I can't read it on my screen here. Looking at acetaldehyde levels, not surprisingly, decreased significantly. There was some microbial, GI microbial effects, but it also changes in DNA damage. So it really showed some effects in humans on potential pathways that could be related to carcinogenesis. Um, so some thoughts that I had on needs for future research for epidemiologic studies. We need more precise measures of alcohol intake. Perhaps technology could help with that, with more electronic ways to collect information. We need more information on long-term alcohol use and changes in use. We have plenty of data showing associations between using alcohol um, and whether there's an association, but we don't know much about whether somebody changes their amount of use, what effect that has. We know dose response associations, but we don't really know what the dose is. We know that people drink more, they have higher risk. We just don't know, we can't really perfectly identify what's a safe level. We need to know more about additional populations, more people of diverse race and ethnic groups, people at high risk for breast cancer, and people of different age groups. And then one question I get often asked is, can you change other lifestyle factors or medical interventions to counteract alcohol effect? So a common question is, okay, I go out and drink a lot on Friday night. If I exercise on Saturday, does that counteract the effect of the alcohol? Well, we don't know. Um, and then it would be interesting to have randomized controlled trials of breast cancer biomarkers and alcohol use, either in the acute intake or effects of alcohol cessation in current drinkers, similar to those ones that I mentioned that were for people who were in sobriety programs. So I wanted to summarize what some of the various organizations, cancer organizations, state about alcohol. IARC, I mentioned, they do their reviews, and based on that, they stated that alcohol is a breast carcinogen and that there's strong evidence that specific policies lower alcohol use. I didn't go into detail in that, but they did do a handbook on both prevention with alcohol cessation reduction and then what specific policies might help. And the typical ones that they cited that can help are things like taxation, not allowing alcohol to be sold to people below a certain age, and then lowering or eliminating advertising of alcohol to certain populations. ASCO in 2018 put out a paper on alcohol and cancer in general, and it said it stated that alcohol is causally associated with breast cancer, and it endorses also strategies for reduction in high-risk alcohol intake. The American Cancer Society states on its website that alcohol drinking is clearly linked to an increased risk of breast cancer, and that women who do drink should limit to 1 drink per day. Komen states that women who drink alcohol have an increased risk of breast cancer and that women should talk with their healthcare provider about the potential health benefits and risks of drinking low to moderate amounts of alcohol. So most of the sites are now keeping away from saying there could be health benefits, but Komen still is saying that. And Breast Cancer Research Foundation, they do provide funding to some researchers who are specifically looking at alcohol, so they've put some money into this as well. And they state that women who have 1 drink a day, as defined as moderate consumption, have increased risk of breast cancer. So in conclusion, my thoughts from reviewing this, I'd say alcohol is a breast carcinogen. Studies show increased risk with as little as 10 grams alcohol per day, if you believe the measurements, that there clearly are dose response effects. Associations were seen in most breast cancer subtypes. I didn't present data for that. One problem was that many of the earlier studies did not have available data on particular subtypes of breast cancer. And so when we're looking at subtypes, then you're looking at sometimes only 1 to 3 studies. So there's not definitive things that can be said about that. But there's limited evidence on change in alcohol intake and breast cancer risk. And um, a small number of studies suggest some association between alcohol use after diagnosis and select outcomes in breast cancer survivors. All right, thank you. And I wanted to see if there are any questions.
Hi, Anne.
This is, oh, Jen, go ahead.
Joining from clinic. Thank you for such a careful and thoughtful review. It's really helpful to see the details and the statistics and which help us because this is such a common issue that we encounter in clinic frequently during a day is this question. So thanks again for putting together such a comprehensive review.
Thank you.
Hi, Anne, good to see you. Thanks for a great review. I think I'm wondering, after your review, where do you think the strongest evidence is right now to guide the decisions for women who already have breast cancer and who are thinking about decreasing their alcohol intake? Rachel Young and I have been working on a pilot intervention with Jamie Hefner on reducing alcohol intake in this population. But as you know, that there's doesn't seem like there's still a huge gap in the research.
Yeah, I think that is a problem, and I was surprised at how little there is. But when you think of how difficult it is to collect information and how seldom it is collected, then it's more understandable. I don't see strong evidence that alcohol is a health benefit for people with breast cancer. One thing I didn't go over is that alcohol is strongly related also to other cancers. And we know people with breast cancer have increased risk for several other cancers. So this could be one way to saying, well, somebody's got a cancer, maybe alcohol is not going to be as beneficial for them. It's really not, I presented the data on cardiac disease. It's not in a lot of studies that's been shown. So it's really not clear that you can say to those patients, especially people who've been on cardiotoxic therapies, that, oh, alcohol is going to be helpful for you. I think that's really, I think that could be one thing to make sure that they understand that if they're, and there may be things coming out from the government saying that heart disease is helped with alcohol. But to remind your patients is that, well, they may have some risk that the general population doesn't. And so if there's no health benefit, then perhaps that can help that individual say, well, okay, maybe there are other reasons I can decide not to drink so much. The quality of life could be improved in some ways if they're cut back on alcohol. Sleep can be improved. For example, when I started with my disclaimer that I don't drink alcohol, that's one reason I started having decided not to have any alcohol before I kept to the 1 drink a day at most guidelines. But there's certainly sleep effects. And so if any other things that your patients may be dealing with, if you can say, yeah, reducing alcohol might be helpful to deal with this, and depend on what's important to them. Do they use alcohol as a social setting? Are there other things that they could use to substitute? And I agree. I think more data should be collected. Perhaps the Women's Health Initiative, which does have ongoing multiple surveys of food frequency questionnaires and would have alcohol intake over time, might be able to do some additional studies. But for something that's so common in around the world, So we have a carcinogen that is so common, we really need much more information.
And it was lovely to hear you say that, and really fun because the work that Heather and I and Jamie and Ty have been doing really highlighted that all those things that you just said, really focusing on the quality of life and the sleep and those other elements, and then really thinking about it in a shared decision making kind of way.
And Nancy, a couple slides back, you said something about randomized controlled trials. I think I wasn't focusing very well. Randomized trials and biomarkers. What did you mean by that?
Well, it's always interesting to know can reducing alcohol, or does alcohol acutely affect something, where that can give you more information about um, about the biological effects of this carcinogen. But if you could design a trial, for example, where you randomly assign people to, say, the night before, drink an alcohol or a non-alcohol drink, and then see the next morning what effects on biological effects might be evident. I was really intrigued by the studies that were reviewed by IARC on people who were constantly drinking, who had alcohol substance abuse, entering programs, and then agreed to be in a study where they were followed to see what effect alcohol cessation has on markers of carcinogenesis. And I think there's more that could be done related to breast cancer. In fact, I don't know, very little that's been done in terms of breast cancer, except for looking at hormone levels cross-sectionally in people who either drink or don't drink.
So very short term.
Pardon?
That's what we're talking about, right? Okay.
Yeah. I think that one thing I think has changed over time, I remember 10, 20 years ago going to cancer centers, meetings, there'd been a lot more alcohol served. And this is to to oncologists, to cancer researchers. And the last times that I've been to them, there's much less. So I think just getting the information out to the cancer community, I think is helpful. That if somebody can choose to drink some alcohol, but maybe help everybody drink less, and that it's acceptable and just fine to drink less, I think would be helpful.
There are data out there. I just pulled it up for a patient this week that show that it's probably the least well-known carcinogen of all the carcinogens, that people recognize obesity over alcohol as a carcinogen. And so I think there's just general awareness that isn't there in the population. And my patient was quite surprised to hear that alcohol was a carcinogen. And I think that that helps people sort of understand and be more contemplative or pre-contemplative about how they choose to, their lifestyle and those sorts of things.
Yeah, I agree. I liked the ASCO paper when they gave some, the state of knowledge in cancer and alcohol, and then called on providing support for oncologists and other clinicians who are dealing with patients as well. And there are some things in the public on alcohol and cancer, but it may be that researchers notice it the most, and that may not get nearly enough airtime in terms of helping people understand. And I think there's efforts back and forth between promoting any health effects that there may be on cardiovascular disease, if they're correct, and then kind of the effect on breast cancer or other cancers gets lessened, I think.
Yeah, it's also it's like a multi-billion-dollar industry, which I think that as I live in West Seattle and I cross the bridge and there are always a bazillion different billboards up there, but alcohol is always up there. And
Mhm.
um, the other thing I tell my patients is just pay attention to how often when you're watching your sitcom, you're streaming something, how often people are drinking on TV, and just how similar that is to 40 years ago and who was smoking in different situations. It's kind of ever present in our media.
I agree. In social media, people are passing around information. As it happened a lot during the pandemic. I understand that people ended up drinking more, for whatever reasons, and they're spreading the information about how they're enjoying this. And so, social media could be another way for to spread the word. I know that I think Dr. Hefner has looked at knowledge of alcohol as a carcinogen, and I think even the Hutch has a story about that on the website. I don't know how many of the public is seeing that, but that's the sort of thing that could be spread.
We need to get mocktail folks to support our breast cancer research funding opportunities.
Mhm. Yeah. I did look at the websites, so the ones that I um mentioned as I was looking to see what they had to say about cancer, to see and alcohol, to see if they were listing support by alcohol industry, and I didn't see anything overtly there. I mean, there may be some very big corporations that own a lot of alcohol industry, but and so it really didn't. I didn't see any red flags there, but um, it is an issue. Is industry, what are their interests doing in terms of cancer risk?
It's my understanding that there are a couple of countries and a few states that have started implementing cancer, like alcohol as a carcinogen label on alcoholic beverages, which will be interesting to see what happens.
Yeah, yeah, definitely. Well, and the World Health Organization says that there's no safe level of alcohol. And so they're talking in general, not just about cancer. So so that's helpful. But I'd love to know if the answer to the question that patients do ask and the public does ask is, can you counteract the effects? So if they love having their beer every night or their glass of wine, are there some people that aren't going to be at very high risk, or is there something they can do to counteract it? And I know there have been quite a few efforts to look at dietary patterns or lifestyle patterns. And from what I've seen in terms of breast cancer risk, from what I've seen of those, um, alcohol's a major contributor. So it doesn't really look like any of those particular lifestyle factors are gonna counteract alcohol effects. All right, it looks like it's getting close to the top of the hour. Glad that you're able to, people took the time to listen to me and to give me your thoughts. And that, again, I really enjoyed giving the talk, but I enjoyed also getting more up to date on the topic.
Thanks, Anne.